Hey, I'm Kara. I'm an ultrasound tech, and let's talk today about what could be happening when you don't see a fetal pole at your first ultrasound scan. Now, this question, along with many other ones that I have gotten over the course of the last almost year of being on TikTok and posting consistently, I have compiled a nice PDF document that is available to you guys through the link in my bio. And that, along with a couple of other documents that I thought would be helpful for those who are experiencing pregnancy for the first time, or for those moms who want a little bit of extra insider info to their ultrasound or just pregnancy in general. So I went ahead and I included a few things that I thought would be helpful for those of you that are expecting, including the top questions that I get asked here on my TikTok, your guide to genetic screening slash genetic testing. So I basically broke that down into more simple terms for people to understand a little bit better, hopefully, as well as a few other documents that I thought would be helpful as well. This is just to have everything that you may want to know all in one place so you don't have to scroll through all of my videos and have to filter through all this information. It's just in a nice, easy to read format with a bunch of helpful documents for you guys. Anyways, let's get back to the question at hand. So, the two scenarios that could be happening when you don't see a fetal pole at your first ultrasound scan is either number one, the pregnancy is just too early to be able to see a fetal pole or even any signs of a pregnancy if you don't see anything at all. Or it could be that the pregnancy is not viable, and that is why we are not seeing the fetal pole or any signs of pregnancy on the scan today. Now, the tricky thing is that we are not really going to be able to tell either way until you get a follow-up scan. And the amount of time that we are going to book your follow-up scan for after your first ultrasound is going to depend on what we see during your first ultrasound. So if you come into your first ultrasound and nothing is seen, as in your uterus does not look pregnant, these two uteruses do not look pregnant because they do not have a gestational sac, a yolk sac, or a fetal pole seen. But if you look here, the endometrium, which is the functional layer that sheds every month, so that's here in the uterus, kind of that stripe right in the middle of the uterus, that is what is shed every month. So this uterus here is not pregnant. And this uterus down here has a thickened endometrium. So you can see this area here that they're measuring is much thicker than the one that they were looking at up there with the other uterus. So this area here is thickening. And basically, this is the pre stage in us being able to see the gestational sac and any other signs of pregnancy. But when a patient comes in and all we see is a thickened endometrium or just a normal looking endometrium in the uterus and no signs of pregnancy, as in a gestational sac, yolk sac, or fetal pole, usually we are going to be booking this patient in 2 to 3 weeks' time. We basically just assume that the patient is coming in too early to be able to see the pregnancy, and that's why we are going to book the follow up. The radiologist will usually also recommend to the family doctor to do a bunch of HCG levels as well between the first ultrasound scan as well as the follow up scan, just to see how the HCG levels are trending or how they are rising or even decreasing. In general, HCG should be about doubling every 48 hours in the early stages of pregnancy. So, if this is happening, then that is a good indication that the pregnancy is going normally and that we would be able to see something at the next scan, the follow up scan, when the pregnancy is farther along for us to be able to see anything. If you come in for your first scan and only a gestational sac is seen, so this is the gestational sac, that is just that big black area there, but with nothing in it, then again, it could either be you are too early along to be able to see anything, or it could be a non viable pregnancy. Now, with a gestational sac like this over here, if that is the only thing that we see, we are going to be measuring it in 3 dimensions just to see approximately how far along you are. And then we will book you for a follow up scan in 14 days' time. This is because on ultrasound, we can see pregnancies from 5 weeks, 0 days onward. So if we are seeing this gestational sac and this gestational sac only, we can assume that you're about 5 weeks, 0 days or about 5 weeks, 1 day. And therefore, if we book you for a 14-day follow-up scan, you will at least be 7 weeks. And if you are 7 weeks along, we should for sure be able to see a yolk sac as well as a fetal pole with a positive fetal heart rate. And if we do not, then we can for sure confirm that it is a non-viable pregnancy at your next scan, or that it is a viable one when we see all the structures that we were expecting to see. Same goes for when we see a gestational sac and a yolk sac, but no fetal pole yet. except when the pregnancy looks like this, and you can see again, the gestational sac is just like this big black area. The yolk sac is that circular thing right in the middle here. But in this case, we are going to be booking our follow-up for about 11 days out from this first scan. This is because in this instance, you are going to be about 5 weeks, 2 days along to 5 weeks, 3 days along, because that's about when we can see the yolk sac and the gestational sac together. And if we do it about 11 days out from there, again, you're going to be around the 7-week mark, and then we can for sure determine whether or not it is a viable pregnancy or if it is a case of a non-viable pregnancy / blighted ovum at this point. And I thought I would also touch on the scenario in which you come in and you see this tiny, tiny fetal pole over here. You can see the blue calipers are going from the head to bum on baby over there, and that is measuring about 5 weeks, 5 days. In this instance, as well as if you come in anytime before 7 weeks, 0 days, we are going to be needing to book a follow-up for you when you are over 7 weeks to be able to give an accurate due date. Also, at 5 weeks, 5 days, a positive fetal heart rate should be able to be seen. But if we are not seeing a positive fetal heart rate at that point, or a positive fetal heart rate and you are under about the 7-week mark, we will rebook you for a scan in about a week's time, in which hopefully we will be able to see the fetal heart rate then. And if not, then unfortunately it would be considered a fetal demise as well. So I hope this video has cleared up some of the questions that have been asked lately, especially after I posted my first trimester video as well as my 5-week pregnancy video, as to what may be going on if you go in for your first ultrasound scan and a fetal pole is not seen yet. Again, we don't really know if it is just too early to be able to see anything, as in the pregnancy is less than 5 weeks, 0 days, and therefore we cannot see anything on the first scan because you came in a little bit too early, but it is a normal pregnancy. And therefore at your next scan we would be able to see something, or in the second scenario of it actually being a non-viable pregnancy, and that is why we are not seeing what is expected at the first scan. And when you come back for your follow-up scan, nothing will be seen still because the pregnancy is not progressing as it should. And I definitely know how excruciating it might sound to be waiting from your first ultrasound scan to when the follow-up is booked, especially if that follow-up is about 2 weeks out from your first ultrasound scan. But at the same time, we always want to be sure that we are able to definitively tell if the pregnancy is viable or not at your follow-up scan. And it's not just booked within, let's say, a couple days or within a week when it should have been 2 weeks, and then you come back and still nothing is seen. But that is only because, again, you are still too early. So that's why we have those guidelines in place. And I know the time frame in the follow-up may seem really, really long, but it is in place for a reason. And it will basically be a waiting game until your next scan to determine whether or not the pregnancy is going to be viable or not. But again, your doctor can go ahead and order a couple of HCGs just to see how things are trending, and that will at least give some sort of indication as to whether or not things are viable. Or obviously, if you are having concerning symptoms such as bleeding or cramping between your first scan and the follow-up scan, then that could be a potential sign that the pregnancy is going to be non-viable. But again, we are not going to be able to tell either way until you come back in for your follow-up scan.